And that's a direct response to folks like Lawrence who are advocating for us. So it's amazing.
Well, I don't really call it advocacy too much, but I call it myself throwing stones at the government.
Welcome, everyone. I'm the Captain Ross Memphis Pambrun, and with me is the co-host and my friend, the President, Lawrence Gervais. We're broadcasting from Calgary in Region 3 of the Métis Nation of Alberta, which is part of the historic Métis Nation homeland. We would also like to acknowledge these lands are the traditional territories of the Blackfoot Confederacy, the Siksika, the Kainai, Piikani, Tsuut'ina, and Stoney Nakoda, with whom we share this land on the basis of our historical and ongoing relationships. We would also like to say thank you to our First Nation friends, to the Métis settlements, and to the Métis brothers and sisters and families. We would also like to give thanks to our elders for the guidance and to Mother Earth for the time she allows us to be here to use her bounty. And now, folks, let's get the wheel squeaking. Here we are again, Lawrence, another week of your and I conversation. Conversation from a Métis perspective. Folks, as you heard, you're listening to Ross Memphis Pambrun, the Captain, and with me as always is my very good friend, the President, Lawrence Gervais, bringing you conversation with a Métis perspective. And Lawrence, there's a number of things that we need to hit on today. And I know we want to kind of be a little bit brief about talking about some of them because we have our most delighted, wonderful guest coming on our show again, who's been here before. And it's the crucial time that we have her when we're leading into the vaccine rollout. So our guest today is the Director of Medical Health for the Métis Nation of Alberta, Reagan Bartel. So she is going to take us and educate us a little bit as we move forward here in the vaccine route. But Lawrence, before we get to her, there is a number of things that I know you and I have been talking about. Take us a little bit through some of the things that are happening within our province right now, because the one thing that we're going to get to is we're not at the golf season yet, and that might be a little bit of a giveaway as to some of the challenges that some of the most famous golfers in the world have been affected by this week. But let's talk a little bit about the province before we move into our conversation with Regan.
So you want to talk about golf or you want to talk about...
Okay, let's get to golf first, Lawrence.
Okay.
What do you think about it is such the poor fellow Tiger Woods? I feel so bad for him with the accident that he just recently. Are we going to see him golf again? I know the whole world is going to ask that question. Boy, he's been 5 back surgeries, so badly beat up. I don't think there's anybody who wasn't aware of the fact that he just recently crashed his car coming, I think it was from the Hyundai Genesis event, and badly damaged himself to the point that he had to be cut out by the jaws of life, which I'm very, very familiar with. And he was taken to the hospital where they had to do major surgery on his right leg.
Well, if anybody can recover from a bad drive, it's Tiger Woods. Sorry.
In a multiple number of different ways. Yes, he has managed to get out of there, but no club.
I make jokes lightly, but he's a professional athlete,
Yeah.
And it all depends on his age and how he can recover from his injuries, right? He has serious fractures in his lower and upper fibula, right? And that's a very hard injury to go through, even as a professional athlete. So we'll see, right?
As we reel in the golf world, the other one that happened recently was our poor actress, Ashley Judd, another poor individual, but she was in the Congo doing some really positive work for the bonobo monkeys, managed to slip, shatter her leg so damagingly that she couldn't get off the forest floor. And it was 5 hours before they managed to pick her up, put her in a sack, carry her. I think it was something like 8 hours to get her out, put her on, so she got some time to rest before they put her on a motorcycle, drove her. It was 55 hours with a shattered leg and no pain medication, seemingly, from what I understand, until she could get to a hospital where they could get started on any kind of treatment. So I don't know what it is with celebrities and broken legs lately, but yeah, that was not a drive that she could get out of. But imagine riding with a broken leg on the back of a motorcycle.
They put her in a sack?
They strung her in a sack as 2 gentlemen were carrying her. So it was almost like a hammock that she was in, and you see her in the picture, and she's just crumpled up inside this as they're carrying her out. Phenomenal distances, I guess, just chewing on a piece of leather because of the pain. And now she's had surgery. They're trying to sort out, but yeah, seemingly the poor thing is in a bit of a tough state because of the nerves that were impacted by that. So let's hope the best for her.
Yeah, when was this accident?
This was probably only about 10 days.
Oh, really?
Yeah, and the information is really starting to come out there, and she's done a great job of thanking all of the members of those communities in the Congo to say thank you. And you know, she talks about if she didn't have her influence and her history from where she'd come from her acting for all those years, she doesn't think she would have survived. And you know, she ended up getting to a hospital where she could get some start of treatment, get some splinting done, to then the next step where they're you know, we're able to fly her, I think, back to the United States. And just one more unique challenge of trying to put this all together during COVID. So,
well, I mean, all the best to her too. I mean, it sucks.
Yeah, that difficult time. Let's talk just a little, Lawrence, about the province before we bring on our guest, Reagan Bartel.
Yeah, I mean, we have Constitution Commission moving forward. It's going to our members to decide. They're going to vote. We'll see how that goes. I know the first draft that they unleashed on the roundtables got a lot of feedback, and they're going to use that feedback and come up with a what we heard document. And then from there, work on the next draft. And that'll be going from hearing to hearings and all over the province. And we'll have some down here in the region and hopefully come to a very good vote in August. Or if we need to make more, if it becomes a no, well, then we have to go back to the drawing table again and redraft another constitution. So we're just part of the process right now. And really, at the end of the day, it shouldn't be me as a member of provincial council deciding the constitution. It should be the members, number one.
Yeah, and I think you're doing a great job in our conversations of disseminating the steps forward as we move through this. But you're right. It needs to come from our membership, our citizens saying, yes, the information's been supported. The direction seems as though we have a good plan in place, and let them decide.
Yeah, and from constitutional experts I've talked to from Ottawa, and we have one currently who's retired here now at the region. You know, he said that they're about 70 to 80% there on this draft. So,
good, yeah, huge.
Yeah, it's just a matter of time, and it'll get there.
All they're doing is drafting a constitution. I don't see why they couldn't do that overnight. And we will see those changes as we move forward, just like we see in changes in our own constitution. So, a little bit about coal mines, Lawrence. There's been a number of articles out recently regarding some of the Aboriginal groups having conversation. Didn't we come to a bit of a stall on this? Hasn't the province said, well, we're really not doing anything?
Well, right now there's two communities, Siksika and Kainai, that have concerns over the coal mines, you know, and we kind of share a little bit of that too, but there's no consultation triggers right now. So, you know, once that happens, they have to come to the communities to speak to us. And, you know, that's the place where we bring all these concerns forward, right? In that process. And none of it's been triggered. And I don't anticipate a consultation process for quite a while. So,
okay,
you know,
so
we'll see how it goes. I mean, they can certainly state their concerns now. That's pretty valid. But at the end of the day, the mines themselves still have to go through the federal process and provincial process to even be okayed. And a big component of that is consulting with your neighbors.
So I guess we don't necessarily have to start blockading the highway because we're not seeing the trucks rolling out of town on their way to strip mine.
No. And a lot of the things that the mines currently do is testing, right? And they're just getting ready for what they need to do to get their applications in, right?
If they decide, and if we end up allowing them. Okay, so we're in a bit of a stall, but I think it's important that people become aware of that conversation. So Lawrence, without further ado, I think this is our time to bring Regan into our conversation. Folks, as she comes on here shortly, thank you to all of our subscribers. Make sure you click that little red box. This is the stuff that makes sure that you're connected, that we're connected with you, and that you reach out to us. and it just helps strengthen our conversation here from a Métis perspective. So Lawrence, if no further ado, let's bring on our guest, the medical director, Reagan Bartel. And done. And Lawrence, here's our chance to invite our guest to the Squeaky Wheel. As with a big smile and always, both from the president, Lawrence Gervais, and myself, Ross Memphis Pambrun, with us today as our great friend, our respected, I consider you a leader within our medical community, the Director of Medical Services for the Métis Nation of Alberta, the province, Reagan Bartel, or Regan Bartel RN as well.
That is true.
A lot of folks know that you and I have a history when it comes to our time together, having worked in the same area, not necessarily at the same time, up in Edmonton in our relationship. And you've been a guest on the Squeaky Wheel a number of times, not just because of your extreme experience, not just because of COVID, partially because you're absolutely fantastic to talk to, and you share your connection with the Métis community in a very strong way. So, Lawrence, let's welcome Regan to our conversation.
Well, you guys, that is an incredible introduction. Thank you. It's always my pleasure to be here to chat with you guys. And I have lots of information for you today, so I'm looking forward to it. I don't know where you want to start. I think that kind of the big thing on everybody's mind right now is the vaccine rollout, which kind of started in earnest yesterday, and wasn't without challenges, if we're being completely open and honest, which we are always with our community. So as of yesterday, the province opened up vaccines to any Albertan who is 75 years and older, residing anywhere in the province. And so that meant that any of our elders or seniors who fell within that age category were welcome to book an appointment. And that's kind of where the wheels fell off. There were 3 ways to book appointments yesterday, and they opened at 8 o'clock in the morning. And I feel like at about 8 o'clock and 30 seconds, they had completely crashed. So there was a vaccine booking system online through Alberta Health Services, and you can find that information on the M&A website. We've shared all those links for people who are continuing to try, but the site itself saw such incredible volumes of people who were trying to access vaccine appointments that it just crashed. It crashed when you put in your name. You might make it all the way till the end, putting in your postal code to figure out where you were going to go for your vaccine, and it could crash then. There was no rhyme or reason to it. So I am very compassionate, to the people who are the technical staff trying to manage these things, but it certainly was frustrating. And we did hear from a lot of community members from across the province who were just throwing their hands up in the air. The same happened with the 811 telephone. So for seniors who are 75 years and up, or for their families who are trying to book appointments for them, you can also do it through 811. It also experienced incredibly high volumes of people. And as a result, people were getting calls dropped, or they were on hold for hours and hours and hours. And it didn't seem to matter what time of day. So it was pretty aggressive and challenging.
I think, in our province, that as you and I've had conversations before, this isn't exactly sneaking up on us. And I know we're not here to throw stones at our government and have these conversations. I work in the world of IT. It's not like we didn't know these things were going to happen. And I think one of the biggest struggles for definitely our seniors and anybody who wants to try and connect through any of these programs, we need to explain to these kind of agencies, you knew this was coming, and we know we're going to see situations like this again in the future. And Lawrence we've talked before that the Métis community has struggled to try and have conversation within the provincial framework to say, we can help you. We can help our citizens. We can help organize and coordinate some of these things. And yet, I guess this is what happens. We just look and go, well, let's just rely on technology that nobody's actually tried to work on for some godforsaken reason.
Yeah. And we're repeating our mistakes. Yeah. And that's the part that really is frustrating to me, pardon me, from a technical standpoint, is that we had the exact same issues for testing rollout. It was the same booking, the same booking style, telephone and online, and we had the exact same problems. And so a year later, we didn't improve on that. So while I look with compassion to everybody who is doing their best to roll these out, I share kind of some of your disappointment. I'm trying to be PC because I still do have to have a really good working relationship with both the province and Alberta Health Services. But the reality is, I've shared my disappointment directly with them, even in little things. You talked, before I go into that, there's one more way people can get vaccinated, certainly in your region. So select pharmacies in both Edmonton and then for your regions in Region 3, Red Deer and Calgary are now able to book appointments as well for those seniors 75 and up. So I would honestly recommend looking at booking through some of those local pharmacies, because I think that will cut down on some of the frustration. I think it will just make it a better experience. But to circle back to that concept of how the Métis Nation could help out, Lawrence and I have been attending meetings left, right, and center, to convey the ways in which the MNA has capacity and really wants to support community. And I do share more disappointment because I'm seeing photos of these mass immunization clinics being rolled out with the province, and I haven't had a phone call to say, hey, do you want to be there? And we're not there in the health service capacity, because obviously it's the role of Alberta Health and Alberta Health Services to deliver the vaccinations. But I would like to have a presence there so that our community knows they're welcome. And, Lawrence and I can talk till we're blue in the face and say these things, but without an invitation, without that, awareness of where the clinics are, when they're happening, it does become frustrating, because you feel like you're doing a lot of talking and you're taking the voice of community who are, being vulnerable and sharing their needs, and we're not even being given an opportunity necessarily to act upon them. We're hoping this will change with the second phase of the rollout, which I would like to congratulate Lawrence, President Gervais, and the rest of the MNA leadership for successfully advocating for the inclusion of our community in phase 2, because that was not part of the initial rollout. And I do believe that is a direct response to the advocacy efforts that the MNA has done. It's not nationwide in terms of like all across Canada. So we know we have strong voices in Alberta fighting for our community and lifting us up. And so, we can look to our partners in Saskatchewan. They have not had the same successes in including Métis citizens in Saskatchewan. So, we're really grateful and fortunate to have the leadership that we have within our nation, because they are succeeding. And as a result, we are part of Group A for phase 2. So that means all Métis citizens 50 years and older will be able to access vaccines as early as April 1st. That's huge. And that's a direct response to, folks like Lawrence who are telling it how it is and advocating for us. So it's amazing.
I don't really call it advocacy too much, but I call it myself throwing stones at the government, because I can, right? Maybe you guys can't, but I can. And, I actually threw a really heavy boulder at them, to be quite honest. And,
you did. And it worked.
I want to also give this time, if we're congratulating each other, that's the portion of this podcast, but maybe I want to congratulate you for helping my parents get it in Saskatchewan too. They're getting their needles today, of all things. So I wanted to thank you for that.
Oh, you know what? I think it's one of those, we can have a conversation on colonial borders on another podcast, but it is absolutely my pleasure to be able to reach out and kind of speak to like technical staff in other provinces, because it really is important to recognize that we have a mandate in Alberta, but we're part of a larger nation as well. And so it's honestly my pleasure. And I'm so excited for your parents. That's fantastic.
And I know, federally and provincially, we're trying to manage, and we're trying to follow even the other countries saying who should receive it. And here's some of the philosophies why. One of my concerns too that still remains is, I hope the Métis Nation approaches this at the same rate that we're trying to approach the rest of the province, respectfully, but saying we want to be included in the conversation. What I've found I've run into is I have family members who've received phone calls saying, yes, it's time to book your appointment. You're over this age. And they'll often make that first comment and say, well, we know people who work in the hospital who see people our age and all ages who have not received the vaccine. And these are what we would consider frontline workers. And I respect, the people on my side who go, I would be willing to wait because these people who have been identified as you are the priority, yet the government still hasn't done that either. And then I asked these people, well, have you even received a phone call? Because you work with the sickest people. No, I haven't even received a phone call. But when you ask the people who are calling, oh, no, all of the frontline workers in the hospital have been taken care of. Really?
Yeah. I share that. And maybe one thing, since this is going to be a live podcast in your region, we've actually had Métis healthcare workers reach out directly to me and say, hey, I work in long-term care and I haven't gotten my vaccination. And I reach out and follow up. So that is an invitation and I expect my inbox will probably explode. But honestly, I'm here to support our community. And so as a result of that, we found little tricks like a lot of the healthcare providers are being sent emails to book. Well, they're going to spam folders. So there are little tricks but I also have the ability to connect on the back end and wag my finger or throw stones, as Lawrence said. And we have been successful every single time we've done it. A lot of times it is an oversight. So I would definitely invite community to reach out either through the navigators that are locally and they can connect with me or to the health@métis.org email address. And I can work to advocate on multiple levels, not just on the broader provincial, rollout, but at an individual level, because that's the difference between us and other government. Like we are community, I caution patience because I am also just one person, but I can commit to that. That is also part of my role.
And that's absolutely the part that I think Lawrence and I often try to say when it comes to the reason we are involved in the Squeaky Wheel and the connection. This is our community. Someday this will all be reassessed and reevaluated ad nauseum for years going, on this day, the government didn't say this and they should have said this. That's looking back. I think we're trying to do something positive here. And again, just because somebody sends you a message saying, well, shouldn't I have been received a vaccine, doesn't mean they're going to get it an hour later, but it means you're being heard. You're part of the conversation. And this vaccine rollout still needs to go as best it can. This is the first time in our, reasonable generational history that it's happened. And you can play the games of talking about all the other issues that have come in our time with the Spanish flu, or whether it be the mumps, whether it be polio. Should we have learned more lessons? Absolutely. And I'm hoping this is the one with our new technology that really allows us to learn from this. But we're all still learning. So take us through a little bit more then of the phases that we should be hearing about, thinking about, participating in.
Well, I think the most important thing to remember is that if we have access to more vaccines, and that's what we anticipate, that the rollout will speed up. So I know that people are looking at this vaccine, as that light at the end of the tunnel. And I know when they see how far down the road, like April seems like it's far away, even though it's going to go very quickly. But if we speed up vaccinations because we have more, that will move up. What I can say, though, is that Métis Albertans who are aged 35 and up will actually be rolled out before kind of the general population. So they've kind of given us, by group D, which is still anticipated to occur within that April timeframe, it will be open to Métis Albertans who are 35 and older. So they really are. What I can give credit for is we have presented, our health status, and we're so fortunate to have an information sharing agreement that allows us to report kind of aggregate data. And we know we have incidences of hypertension and diabetes and risk factors that put us at risk for severe outcomes, and they're hearing us. And so it brings its own challenges because we need to get all that information out, and we still haven't heard that. The challenge is we haven't heard how the rollout will happen for these things, but it is coming. So honestly, our community is going to be really impacted by this vaccine rollout starting in April. So for those of you that are not paying very close attention right now because you think it doesn't apply to you, closer to the end of March, really start, if you're not reading all the M&A communication, because we hit you with a lot these days, at the end of March, that's when you need to start looking into your inbox. And we will, as soon as we get information about the clinics, if it changes from now, because I assume they're evaluating what has worked, or more importantly, what hasn't worked in real time. Hopefully we'll have some changes. And Lawrence and I have been advocating for really innovative vaccine clinics. So, potentially working towards mobile clinics, specific Métis specific clinics. We don't have any information as to whether or not that will be taken up by the government, but and those are questions that are coming from community. The other piece about vaccine rollout that I can't give you concrete information, but I want to acknowledge that it's a question that's really coming out of community, is the concept of whether or not you need to bring your Métis card in order to receive that vaccine. I don't have that information at this time. What I have been told is that all self-identified Métis will be included. So that opens up a whole nother kind of discussions that we're currently having with the province. And as a result, I don't have an answer to whether or not you'll need to bring your card or not. At this point, it seems very likely that if they're going with the self-identified status, they won't be requiring a card. But that information will be something I'll get to President Gervais as I learn it, and we can disseminate it out to your region and Region 3 and across the nation for sure.
And I guess a question, and Lawrence, I'd be interested in your opinion on this too, because we had this conversation once before. The Métis community typically comes from a white background with First Nations, with Aboriginal, and then you have, the Métis, and we see the timeline of our history and such like that. Well, we still continue to see Métis people with people who do not have Indigenous backgrounds. And the unique challenge of the question of, if you are asking an elder who is married to somebody who's not Métis to say, come participate in our program, and they look and go, well, I don't want to participate until I know that my significant other, so therefore we balance the risk in our own home and or such. I don't know how it really changes the balance of risk by one getting it and one not, but that's a difficult conversation. And what's your opinion? And Lawrence, what do you think?
Well,
how do you approach that?
Go back to, and I'll make this a two-part thing. So go back to the self-identified thing. There's 114,000 self-identified Métis in the province. But, those are people that say on the census, yes, I'm Métis, and they cross that first step of Paoli. But are they getting the other 10 steps in there, like in order to get their status? And I'm not sure how government of Alberta is really going to understand what Paoli means to Métis people, and we have a registration process here at M&A, what our process is in order to get that or attain a citizenship. So it's going to be a very highly contentious issue, I think, for Alberta Health to really decipher that. And if they have no understanding of that and just say, allowing people into self-identify, well, you're opening up a big can of worms for everybody just to run to the table who aren't Métis. They go, yes, here I am. Right now I want my vaccine.
I 100% in agreement with President Gervais on this. I think Lawrence has hit the nail on the head. And I think we can see examples of this in there was, a couple of wealthy non-Indigenous folks who flew into northern BC because vaccines were available in a First Nations community. And, they were able to get that vaccine. I mean, we know the diversity of looks. You can't look at a Métis community member and know whether or not they're Métis. I mean, look at myself. I mean, this is a podcast, so you might not be able to see me if you're just listening, but I look very Caucasian. I mean, if I wear my hair down, I look a little bit more traditionally Indigenous. But honestly, I walk in both worlds. And so it would be very easy for me if I wasn't Indigenous to just put up my hand and say I'm Métis. And so I think there are definitely considerations that the province hasn't thought of, but we look forward to having those discussions. It's on my list of things to throw rocks about, to use Lawrence's term. And I'm sure Lawrence will be supporting me with a few bigger boulders as we get a little bit into that. So yeah, it's really going to be contentious. I think that was a very PC way of putting that, Lawrence, because I think there's going to be quite a lot of conversations, potentially even heated conversations.
Yeah,
on this area.
and we also have to look at, how the government going to perceive themselves, because we don't work on a blood quantum scale like they do in the States, or by appearance. You can't identify an Indigenous person by that anymore. So, we're going back to pre-colonial terms, and, government sort of deciding who Indigenous folks are, and we don't want to put it in their hands to do that. And then number two, to answer your spouse or within your household, having a Métis husband and a non-Métis wife, and they're both, you have one that's a 15-year, difference or whatever. Yeah, I'm open to that conversation. If their vaccines are available for a household with a Métis individual in it, that might be another option to look at. But yeah, I'm all for it. It's just, we have to create the argument and bring the discussion forward.
Yeah. I think the other thing to think about is, in terms of couples, I think there's a misconception within the general public that the vaccine itself is curative or will absolutely protect you. And the reality is it's another public health measure. The vaccine alone is not going to protect you from getting the vaccine. It will decrease your risk of getting it, and it will decrease your risk, if you do get it, of having symptoms, so you're less likely to transmit it. It will also decrease your risk of having severe outcomes related to the disease. So really, getting it at different times is really problematic, but at the same time, we still have to do all of the right things, even if we've been vaccinated. And I think there is that misconception out there, around that. But we are actually, that is another advocacy piece though, Ross, that we are working on, because we do know we have many blended households. And if one is deemed high risk, it would be great to have them both protected. And also we know our community struggles with, transportation to clinics, and a lot of these clinics are centralized. And so if you're asking somebody who potentially is has a lower capability of getting to a clinic to try to get there twice, it's hard. It's that whole vaccine supply. If that was not an issue, we'd be golden.
Well, yeah. And I would like to think that we would be using more, not let's say novel approaches, but coming up with more allowable approaches for how we would expedite, this rollout. But again, reasonably, I have to look at it, and having been in healthcare for many years, if you want to follow certain safeguards, because people have said to me, well, why don't we just send a needle around to everybody's house? Well, that's not the worst idea in the world, except people have to feel comfortable and understand what the side effects may be and the reaction, and ensuring that it went in properly and or that they're actually utilizing the vaccine appropriately. So these are challenges, but we don't have enough. So we've got to approach it that way. But is there anything else you'd like to hit on when it comes to something people should be thinking about the rollout? Because I know we've read, and Lawrence and I have talked, there are some great wellness programs that are coming out, and I'd like to get to some of those conversations. But is there any point, any specific 1, 2, 3s we should really be thinking about, other than reminding people, folks, make sure you connect with Métis.org, connect with us, Métis3.org, send us your emails, make sure you're connected in the community, check your spam folder, because if we're reaching out to you, or the communities are reaching out to you, that you followed those, return the phone calls, put your name in there, have your card ready. Anything else?
No, you know what? I think you've got it. Maybe the only other thing I will touch upon is education. So we know that people are on the fence about vaccines, and it's a very personal decision. And so I think it's just really important to know where to go to get that information. And so the Métis Nation of Alberta is hosting bi-weekly vaccination information sessions. And we had 70 people attend last night. And the questions are really fantastic. They're not recorded because we want to create a safe space. We know there's a variety of opinions around vaccines, and I don't want people to feel judged. So it's an open space for people to come hear about the vaccines, hear about rollouts, ask any sort of questions. And if you feel that you need another one specific to Region 3, you can reach out directly to Region 3. And I would be happy to, do another region specific vaccine information session. So I think that's maybe where I'll leave vaccine rollout. And And I would love to talk about the wellness programs that we've got, because I think it's an amazing opportunity to support our community. So
yeah, and wellness, having my last company having been in occupational health, was we often ignore it. And folks, these programs we've talked about, Lawrence and I have talked about the harvesting programs, the youth programs, the seniors programs, all of these programs that are out there. You need to utilize them. Reach out to communicate with the nation, with your region, with your locals, saying, yes, I'm interested in these. The more we become aware that people are interested and are utilizing those wellness tools, the better we will have as an opportunity to continue to sponsor, fund them, and have people like you create the guidance in order for us to find what meets, let's not say the most popular issues, but the ones that are affecting our population now, but also recognizing things that are in the future, or things that may not affect all of us, but we need to be conscious of. But I like that this wellness program is geared. It looks like a lot of these are for everyone. Please, yes, let's talk about it.
Yes, absolutely. Oh, can you still hear me? My microphone kind of cut out there for a second. So the Métis Nation of Alberta Wellness Program is actually graciously funded through COVID funding we received through the federal government. And we were listening to community. We've had multiple phone calls of folks saying, you know what, we're just not okay. And it wasn't one thing. It was, in the areas of, I'm just not okay. I need to talk to someone. I'm really struggling because I've lost my job and now I don't know where I should move with my new career. I have children and they're struggling. How do I talk to them? So this is a partnership with Alberta Blue Cross and a service provider called Homewood Health, and they're very well established. Every single Métis citizen has the ability to access this for free. There are 12 hours of services that you can access, and it's typically goal oriented. So if you have a specific area that you're looking to explore, you can identify that to the counselor, and they will be able to walk you through some steps in order to, be well. Yeah. I think it's really important to note that this service is not an Indigenous specific service. So we have given cultural training, we've given all of those safety components, and Homewood Health, I've actually had Métis citizens reach out to me and say, I want to be a part of this. And I said, well, it's with Homewood Health. And they've said, oh, I already work for Homewood Health. So I know there are Métis and Indigenous counselors and support staff that work with Homewood, but I do want to caveat that we know we have a diversity amongst our community members in how they need to tackle their health and wellness. This is a more contemporary style of counseling, so it won't have the traditional ways of healing that some Indigenous folks are looking to connect with. So I just want to caveat that, but it is available 24 hours a day, 7 days a week, 365 days a year. It's also open to all ages. So if you have a child who is really struggling right now with focus or just acting out because of the pandemic, you can phone this service and connect your child to someone to talk to. Now, I want to manage expectations because it is a virtual and phone service that is available across the province. They will require a guardian to accompany that youth for the services initially. And if there's then time that they need private talk, it'll go there. But just for those who have kids, don't think it's not for you, because they can work with families. They are very well aware that family to Métis community often means community members, cookums, aunties. So they've kind of been made aware of some of the unique considerations that we have within our community. I'm incredibly proud, and I can share a number that's kind of preliminary for our first month of operation. It's only been going since February. We had 72 Métis citizens access this service in the first 15 days. Wow. So it breaks my heart. Yeah. Because it means that there are 72 people, in 15 days that felt that they needed that service. But I'm really pleased to know that exists and that they could reach out and find the help that they needed. I mean, that's incredible. And Homewood Health has even said we've never seen uptake like this. And I think that speaks to the fact that the Métis folks have been typically excluded from, any form of subsidized health benefits. And if we were not, we would absolutely access it. I mean, this is proof of that. yeah, happy to be able to provide it.
I find one of the things in my background working for the city and professional in first line response is a lot of times people are afraid that when I saw that wellness letter come out to all the Métis people and hopefully the people who are making sure they're getting their names on that list so they receive it, I was quite excited that this was becoming available. And what I often tell people is again, regardless of what age you're at, if there's something that you feel is causing any kind of stress, any kind of impact, anything in your family or in your life, if you are concerned about making that call, to me, that is your answer that says you should, because it just allows conversation. And if you're afraid to make that call, to me, that's another reminder that says you need to talk about something, because if you call and there's a comfort and you say, well, I actually don't know why I called, and you work through the conversation and the process, you may find that this just gives you that little bit of strength. And regardless, whether it's your relationship with your child, whether it's your relationship with an elder and your seniors and your family, we are all struggling, and we're not always familiar with what impact this pandemic is having on us. But this is our chance to talk and bless your work and this allowance. Those numbers, though we shouldn't look at numbers always and just say rely on them, that is a very telling number to suggest this program has started, and the mental health on all aspects. So this is wonderful.
Yeah, I'm incredibly proud. And I think one of the things to highlight about this partnership in particular is that the service provider, Homewood Health and Alberta Blue Cross, have been really responsive to what we need. So, I've said it's not enough that we have access. It needs to be a dedicated line. And so we now have a dedicated line so that when Métis citizens phone, they will be received, with open arms, and won't have to worry about trying to navigate that. Well, I'm not First Nations, or I'm not it is for you. And so I think that commitment from our partners has been really great. It's a learning process. I think that nobody knows our community better than the MNA. So anytime we move outside of that, there will be challenges. So I obviously would ask that community is patient as we grow this program. It's only been a month, but I am really incredibly happy. And the number, just in case anybody wants to write it down, it is available on our website, of course, but it's 1-877-729-0261. And you can phone that number any time of day, and they'll direct you. They even have crisis services. If you are in crisis, they'll be able to connect you there. And so I think it's really important. That program is incredibly important. I think the other wellness programs that we have going on right now, we have our dental partnership, which, has been seeing a lot of traction. We've been on CBC about that. We're also growing that program, right? So right now we have services for our youth to access. We have services for emergency, affordable dental care for root canals and extractions. And we have services for affordable dentures. And yes, that is located in Edmonton, but it's essentially 60% of the cost of anywhere else. So it may actually be beneficial to travel to access those services if you needed them. So I think that's, another important thing to mention. And I would be remiss if I didn't mention our smoking programs, because your very own Region 3, Kyla Prakash, is our community prevention practitioner. And she has seen such uptake for our smoking supports. And I think it's really important to know that, we do have higher rates of tobacco use, non-traditional tobacco use in our nation. And I think it's really important to know that, hey, if you're at home and you feel like you might need support in order to, change your smoking habits, or even just contemplate changing your smoking habits, Kyla is available. And that information is also on our website. And I'm sure through Region 3, since that's where Kyla is located.
Yeah, and we've put it on our website.
I welcome you. Yeah, I welcome you to sign up for those kinds of things as well, because, wellness is not just mental health. And the other thing that I think I should bring up right now is I know a lot of our community members maybe do not have a connection to primary care practitioner, so a family doc. The Alberta Indigenous Virtual Care Clinic is an Indigenous specific clinic that is run with physicians who are attached to the Indigenous Wellness Corps. I've spoken with many of them. Half of the physicians there are Métis. The rest are First Nations or allies working within the area of Indigenous health. That service is also free, and the information is on our website. So if you do have a vaccine question, for example, you have a chronic condition and you're like, should I be getting this vaccine? And you don't have a family doc, you can phone them and they will explore whether or not vaccination is right for you, or get a prescription filled. Say you're older and you're just not comfortable going out to see a doctor right now, you could phone them and they'd be able to connect you. So those are just some of the supports that we have going on right now.
I know I'll get my hand slapped when I say that one of the positive things that we've seen come out of this pandemic, and you get slapped just saying anything positive, is that we're learning to connect virtually. We've allowed our seniors and our youth to help our seniors connect. The tools, folks, are the information's available on these websites, the Métis.org, Métis3.org. Regan takes calls all the time. Lawrence is always available for coffee and conversation when it comes to these things. Make sure you reach out to them. I know we only have so much of your time and you need to jump off to some other things. I want to say thank you so much. These are the messages that we need to share with people and that they need to hear. Lawrence, perhaps you could close out our thank you to our wonderful medical director.
No, I know you have to leave, and I want to thank Regan for coming on the podcast today, and look forward to more conversation and more, possibly maybe next time we see her, maybe we'll all have the vaccination. So
right,
we'll all share.
Yeah,
one can only hope.
Yeah.
Okay, well, I'm gonna excuse myself then,
Thank
guys,
you so
and
kindly.
have a wonderful remaining discussion.
Thank you.
Chat soon. Bye.
Oh, Florence, it's not exhausting. We how often do you and I get into conversations with our citizens, between each other, with our significant others, just like everybody else having these conversations. But I guess when it comes to your role and its connection with our region and with the province and our role together of sharing this conversation, boy, sometimes it gets tiring. But this is the job. If the importance of sharing her message, and if she gets the message out to us and gets the message out to you, and we can share that message, we reach so many more people. So thank you to all of our listeners for every time that you connect. When you click that little red box that says subscribe to the Squeaky Wheel, it reinforces the need for Regan to share her conversation. When you email us at tsw@métis3.org, it reinforces that we're answering the right questions. Lawrence, let's talk a little bit about what you think our region needs to really focus on when it comes to our conversations or further conversations with our seniors, with our elders, with our youth, regarding this rollout.
Well, it's staying connected, like she's saying, in real time as best we can. As a community, we need to be able to effectively communicate to them in a rapid manner because, things change on a day-to-day basis with this rollout. So it's, information and decisions are made, and then, next day action happens, and they're calling people or they're trying to get a hold of people, and all that happens, right? So yeah, it's just, I think how we do this rollout is just basically communicating effectively to try to do it, because right now we're not hosting our own clinics. We're not inviting our own people, but we're trying to get the message to them to make their appointments. So then they get there.
I think you're absolutely right. You're right. The biggest message, folks, is stay connected. Stay connected with the community. Participate in the youth and the elders conferences. Participate in the business mixers that we host regionally. Consult with us. Consult with Kyla, for example, if you want to get involved in some of these wellness programs, the tobacco. But if you stay connected with the Métis organization, they're going to help steer the ship and help steer you so that we're all moving in the best positive direction. Yeah, I can't say it enough. And
we need to mention albertamétis.com is the provincial website. So they'll have information, like that's the connection to Regan. So.
Oh, I'm sorry. I keep saying Métis.org. We're Métis3.org. You're right. They are AlbertaMétis.com. And yes, so folks, you've probably found it before. You can send your pointed emails to remind me, so I make sure I say it correct.
If Jason could put their website link right on your face right now, see if you
that
can do
would be helpful. That obviously, clearly, that would be helpful for me too. So, we're very fortunate that Regan finds the time. When you consider how often she sends out her report information, that woman is constantly working. So we're very fortunate to have her. I guess as a little bit of a rant and just touching back on what she had mentioned regarding the struggle when it comes sometimes to people's approach, the issues that we've hit up before with the anti-vaxxers, folks, if you want to have a place in order to make your statement, find other anti-vaxxers. Nobody's convinced me enough, and nobody's come at me with any science at any time to suggest that they have a better argument than working with our nation, working with our province, working with the federal government in order for this vaccine to allow us to get back to what will be a bit of a new normal for God only knows how long. But yes, you see all these groups who seem to have to protest. If you want to protest, stand 6 feet apart and protest. I'm not too sure why you have to get together. If you're trying to make a point, we've seen too many times down, and you read the stories of this person didn't believe in it. This person got their groups together and they fought to say this is never going to happen, and then that person dies. Is that what it takes? I don't know.
Yeah. When the lemmings jump over the cliff, and they have to do it really close together because they push each other. That's kind of
well, and we didn't single out any specific groups. So, folks, if you think you're a lemming, then you go right ahead and you climb. And just make sure you jump over that cliff. Lawrence, you're absolutely right. I guess birds of a feather. And sometimes
if you're 6 feet apart, you're not going to go over, right?
Yeah, I guess not. Somebody's going to come to a stop and go, why are we doing this? So yeah, I guess we're all going to struggle when it comes to that. But I think it was really important that this is the message everybody's hearing right now. This is where the fears are happening. We're all trying to get a bit of a handle on understanding the vaccine rollout. Lawrence, I think I'm okay if we leave it at that, because this was a heavy hitting one.
Yeah, absolutely. And we look forward to the next podcast. And possibly new look coming down the future. I'm not sure.
If it was up to me, Lawrence, as soon as they say our age, which everybody knows is the late 40s, it seems, I hope they let me vaccinate you and you vaccinate me, but you go first, because then I'm going to make sure that I jam that needle into you.
Well, you're the nurse, so you're trained in it. So I don't think you want me giving you one. Yeah.
That's true. I was trained in it quite a bit. So, folks, thank you for listening to The Squeaky Wheel. Thanks for listening to the Captain Ross, Memphis, Pambrun, and with me, as always, my very good friend, the co-host of The Squeaky Wheel, the president, Lawrence Gervais. From all of us here at Region 3, from all of us here in Calgary, from all of us here in the lower part of southern Alberta, to all of our friends within the province of Alberta, and to all of our Métis friends across this wonderful nation, thank you for your time here on The Squeaky Wheel.